Hi, it's Dr. Ann Zink. Today's December 18th, 2020, and I wanted to provide you with our weekly update with where we're at with COVID-19 in the state of Alaska. On this next slide, you can see both the report date, onset date, percent positivity, as well as those who are hospitalized with COVID-19. I really like the onset graph the best because it gives us the most accurate information on where the pandemic is moving. However, it is important to note that the most recent 7 days need to not be looked at. That's why they're grayed out, just because those ones are still tests that are being run. But you can see that really since kind of mid-November, we've become cautiously optimistic as we see this slight downward trend. We've also seen a slight downward trend in our percent positivity. We're hovering just above 6% right now. Again, we'd love to see that less than 5% because the less COVID we have circulating, the less chance there is to getting sick, and the easier it is to do all the normal interactions that we love to do. It's also been great to see a slight decrease in the number of people hospitalized with COVID-19. Currently, 14.1% of all inpatient beds are occupied with someone with COVID-19. And we're hoping that they heal and get better soon, particularly during this holiday season. Here you can see our state compared to other states. Most of the United States is surging in cases right now. Some are starting to slow down, and we're kind of right in the middle of that pack currently. The big news across the country has been vaccines, and Alaska has received its doses of the Pfizer vaccine and have been distributing them across the state. There are numerous ways that the vaccine comes into the state. There are federal allocations, including the VA, DoD, and military, and they are getting in those doses as well as allocating them out. The state is responsible for helping to get a state's allocation, as well as helping in the movement of an IHS allocation around the state. And here you can see pictures from all sorts of Alaskans getting vaccinated. Currently, the state allocation is recommended for Tier 1 and Tier 2 within Phase 1A, and that includes hospital-based healthcare providers who are at high risk for being exposed to COVID-19, EMS, long-term care residents and staff, community health aides and community practitioners, as well as vaccinators. And we're in the process of helping to make sure those vaccines get out to all those groups. Vaccine is still incredibly limited. I wish everyone who wanted it could have it right now, but we're trying to move as quickly as we possibly can and encourage people to stay up to date on our website as we continue to provide additional information. Today, you should see Tier 3 information up regarding additional healthcare workers who are kind of in that next wave for receiving COVID-19 vaccination. Here you can see kind of where we're at with this kind of beginning of the very limited supply, moving into limited availability, and then hopefully widespread availability shortly. We also have another COVID-19 vaccine, the Moderna vaccine, which is currently waiting for EUA authorization. There's numerous meetings with the EUA, FDA, as well as the CDC here this week to give us additional information and to see what happens next. I would also just note that we have had at least one significant adverse reaction, and we're taking a look at a few other ones right now. We want to make sure that we get that information out to the public. It's important that you stay informed about what's happening regarding this vaccine as well as COVID-19 so you can make the decision that's right for you. But I think it's really important to put this into context. While we have had an adverse reaction, the patient recovered very well and is doing fantastic. We continue to investigate this case in combination with the CDC as well as the FDA to better understand what happened. And right now, across the country, we're unfortunately losing a patient a minute to COVID-19. And as a result, we still see this tool as an incredibly important tool to be able to help minimize the risk to COVID-19. However, we have other tools as well, and we encourage you to still use them. And that includes a mask, distance, washing your hands. The vaccine I kind of think of as redundancy. It's an extra tool to help minimize the chance that you become really sick and allows us to not have to continue to have COVID spread so much in our communities and cause such devastation. So this Sunday at 5 p.m., we encourage you to come outside with us, bring a light, and bring back the light. It's a chance to remember those that we have lost, all of the hardships of this year, and think about the change in seasons and the change in the turning point in this pandemic. We really have much to be hopeful for, and as the days become longer, this pandemic too will end. So step outside, take a moment to reflect, and in solidarity, let's work together to be safe and strong. Have a great day, and we'll see you next week. Thank you.